Hello everyone. As I mentioned just now, my name is Ying Zhu, and I'm now a lecturer at the School of Biomedical Engineering at University of Technology, Sydney in Australia. And I just share about my career journey. I did my PhD in Australia in the University of New South Wales. So my PhD group, it was led by Professor Justin Gooding, a very famous world leader in the field of biosensors. So I started my career in the field of biosensors. So what is biosensors? So biosensors are essentially analytical devices that is capable to detect biological species. So that makes biosensors very suitable for detecting like disease biomarkers. So after I finished my PhD, I went to the United States in Dartmouth College, and that is where I started to bring in my expertise in biosensors into the field of cancer diagnostics. So how that are related is that through biosensors, we'll be able to detect biomarkers in the blood to guide the cancer diagnosis through the new technology called liquid biopsy. So essentially, we're developing like a blood test-based diagnostic devices. So after my postdoc work in the United States, I was very fortunate to get a fellowship that is from Cancer Institute at NSW in Australia. So I came back into Australia and work in UNSW again, but in the clinical school. So that is when I start to build like my collaborations with clinicians and try to bring like novel technologies into clinical settings. And at the end of 2020, I was again very fortunate to get a continuing lecturer position with University of Technology Sydney, UTS. So that's where I started to build my independent research group and start to working in a field that we want to develop novel biosensors and bioassays to use them for in vitro disease diagnosis, especially in cancers. Okay, thank you for the question. So as I mentioned, our general goal is that we want to develop like novel biosensors and bioassays for in vitro disease diagnostics. That is means we would like to develop like using our biomedical engineering solution, that is to bring in novel analytical tools to solve some issues that current bioassays in the clinical can't solve. For example, we want to bring up the analytical performance, such as the analytical sensitivity that allows us to detect a very low amount of biomarkers to achieve like early detection of diseases. And one very large field that we've been working on is that we are fabricating like nanostructured biosensors that using nano fabrication. That these biosensors is able to detect like disease biomarker in a label-free way. So that means it will be very quick and also can be developed into like point of care technologies. And that is a very multidisciplinary field that we're working with, for example, optical physicists and also biologists, like combine all this expertise in different fields together and then building up our like a cutting edge technology. And we also working on for example, this PineKind innovation grant is that we would like to see whether we can use new type of biomarkers such as the extracellular vesicles to improve like clinical performance. For example, clinical sensitivities, clinical specificities that can have more accurate result for patient. So that is we work more with like biologists and clinicians, and then we work with like human samples and want to see whether we can bring in like our new assays into the clinical setting. I will introduce more about this project when I come to the this grant. Yeah. Okay, thank you for the question. I think it just now you touched base on some of the information in pancreatic cancer. So early detection of pancreatic cancer is very, very important. This is because the early detection can help the patient to assess more effective treatment options. So that's like will lead to a dramatic improvement of the overall survival rate for pancreatic cancer. However, early detection is very, very difficult for pancreatic cancer. This is because most patients in the early stage of cancer, there is obviously very, very little symptoms. So this patient won't actually go to hospital to check. And also current diagnostic tools in clinics, such as the imaging-based method, are very difficult to detect a small size of tumors in the early stage. And also they are very expensive for the patient. And so that brings in the our concept of liquid biopsy, which means if we can detect pancreatic cancer in the early stage just using the patient blood, that will be create a very promising options for the patient, especially the early detection. Okay, just bring in more information. So what we want to do, as I mentioned just now, is that we want to detect pancreatic cancer in its early stage using the patient blood. So in the blood test, we're targeting a very promising biomarker that is the extracellular vesicles. They are the lipid membrane captured nanoparticles that released from primary tumor cells into the bloodstream. And so obviously, like in the early stage, there will be very, very small amount of these extracellular vesicles in the blood. So how to actually improve the analytical performance, like the limit of detection, is the key in the early detection of a pancreatic cancer using this extracellular vesicle based blood test. So in our previous research, we actually find that in order to improve the sensitivity, we actually need to detect those extracellular vesicles at a single vesicle level. So that means we would like to achieve single extracellular vesicle detection. And so then comes out a question like how are we going to detect these vesicles at a single vesicle level. There are currently a lot of very novel technologies developed in the laboratory, but most of them are very sophisticated, and it's very hard to actually come into the clinical translation. So what we want to do is that we want to use existing clinical diagnostic tools, that is mainly the flow cytometry, and then use these existing tools to detect extracellular vesicles at a single vesicle level. However, as I may mention just now, because the extracellular vesicles, especially the small extracellular vesicles, are in the nanosize range. So these nanoparticles are very hard to be detected by conventional flow cytometry. So what we propose here, a strategy is that we want to use amplification strategies to increase the size and also increase the fluorescence signals from single extracellular vesicles, so make them detectable using conventional flow cytometry. So that's the goal that we want to achieve during this PanKind innovation grant. Okay, so I have already like started establishing my own group. So now I have like a few student, PhD student, and also masters and undergraduate student. And I also achieved great support from our school and also from UTS. So we would really want to like develop our technology and actually using them for an analysis like a patient sample. So to do this, we're very lucky to get collaborations with like very famous pancreatic cancer biologists and also clinicians in Australia. So we have already started to collecting pancreatic cancer patient blood sample. So in the next 5 years, I would like to say that what we want to do is that we want to actually collecting some preliminary result to show that our technology actually working for those pancreatic cancer patient, and then bring into our new technology into like the early phase clinical trials through our networks with those clinicians and biologists. Yeah, and so I think I would say that I'm actually very lucky to get this position in UTS, but I have some like experience I want to share with those early career researchers who would like to start their journey in academia. So I think a very important thing is this transition between a postdoc research into like the independent, say, group leader. Okay, so as a postdoc, what's like a postdoc usually do is that focusing on their research, focusing on their project, get like a publication. But as a independent like group leader, there are more to do. So we have to write grants, we have to build our tracking record, to establish a network, and we have to write grants. So that is mainly very multitasking job to do. So making this transition, how you actually building the tracking record from say just doing research into the other jobs actually taking time, and also it's better to start at an early stage. So what my suggestion to those early career researcher is that you have to like building your tracking record, not only doing your own project, but also say supervising students, getting involved into some teaching experience, and also most importantly, start to build your skills for like grant writing, because for grant writing, that's like we never learn about them, and it takes time. And some early career researcher may think like, okay, I'm maybe not very competitive for this grant, and so I don't want to waste my time. And that is not true, because writing a good grant proposal actually takes time, takes several years, especially like for me, for example, a grant proposal, like it takes several times, I change it several times during different rounds of application. So it's better to start at very early stage, build this grant proposal, and also looking for what's the proper scheme that's you can apply, because some of this grant only targeting very early stage of researchers. If you pass that like stage, you will just miss the eligibility.